we bring to you a panel of doctors who will bust all the myths and doubts on COVID-19. In this hour-long program, you can ask questions from our panelists.
We have to make sure that all of us stay at home. It is very important that we make contact with other people as minimum as possible.
Follow this hand hygiene practice each time you go and wash your hands, and soap and water is the best.
You have traveled to outside for 14 days to the affected countries, or you have been in contact with a patient of COVID-19 proven case, then only you may require test, otherwise you don't have to.
Namaskar and welcome to the special broadcast tracking COVID-19 on national broadcaster Doordarshan. I'm Sakal. But well, we as a nation, viewers, are at a very crucial juncture of fighting this pandemic. We as a nation, we have responded very well to this emerging situation in terms of lot of determination, in terms of lot of discipline, and in terms of lot of urgency as well. And the government at the same time is doing everything possible, firming up each and every effort, whether you talk about medical fraternity or testing capabilities and much more. And today on this weekend programming, especially on COVID-19, we have a very, very special guest joining us live all the way from Geneva. And we're going to talk to her about the big picture. As joining us live on COVID-19 is Dr. Soumya Swaminathan, Chief Scientist at the World Health Organization. She's there with us. Thank you so much, Doctor, to be with us, Dr. Swaminathan, for joining us live all the way from there. In fact, before I come to you, let us also share some more points of your body of work, the merit till recently. In fact, as we have her on our screens, please, she was the WHO's Deputy Director General for Programs. She's also a pediatrician from India and a very, very globally recognized researcher on HIV and tuberculosis. And also, Dr. Swaminathan brings with her 30 years of experience in clinical care and research, and she has worked throughout her career to translate research into impactful programmings. And Dr. Swaminathan was also Secretary to the Government of India for Health Research and DG of the ICMR from 2015 to 2017. Thank you so much, ma'am, for taking out time for Doordarshan. And at the same time, I'm also going to introduce other panelists on the show. Professor Dr. Puneet Mishra. He's from Department of Community Medicine from AIIMS, joining us here in our DD studio. But I'm going to come to you, ma'am, first. First things first, your overall assessment as we stand today in terms of numbers. Do you think that we've done pretty well so far in terms of containing it at this stage, that is stage 2? The challenge initially, you would agree, was to confine this to stage 2 and not to progress to stage 3, or would you say that we are still in some sort of gray area?
Thank you very much for having me on the show. I think India acted very proactively right from the beginning. As you know, this is an unprecedented outbreak with a virus that we know very little about. And everyone has been learning as we have been going along and trying to adopt the best strategies. So in terms of the measures that were taken of screening and isolating and quarantining the travelers who were coming from the affected areas, I think that was done extremely well. And all of our states have demonstrated that they can really do contact tracing, quarantining, and follow up extremely well, even compared to some of the high-income countries that I have seen. Now we are in a different phase where it's not just the travel-related infections, but it's beyond that. And the data that's coming out with expanded testing is showing that the percentage of people who are turning out to be positive is still low. You know, it's still around 3, 4, 5%. Not 30, 40% that you're seeing in the European countries. And similarly, in the surveillance that was put in place by ICMR for the pneumonia cases, there again, the positivity rate was, 2 to 3%. So I think these are very encouraging signs showing that we have picked it up at an early stage, that strict measures have been put in place to further control the transmission of this outbreak, and that a well thought out plan is now being rolled out in every state in order to make this into a sustainable and a long term strategy. I think the lockdown has given that little bit of extra time to ensure that this can go on for many months.
Dr. Swaminathan, we will talk about exit strategy in a bit, but before that, you've had extensive research and you've done lots of papers in terms of tackling such emergencies, such situations. Many would say that South Korea responded to the situation at the very outset very, very efficiently. But then at the same time, not really drawing any comparisons, the world is looking at the way India has dealt with the situation. So I would want to know from you, ma'am, our viewers would want to know, first of all, lessons. Can we learn some lessons from South Korea, the way they did it? And avoid the mistakes that US did?
Yes. So I think public health and basic principles of epidemiology are very important to follow. This is an infectious disease. We learned very early on that every infected person could infect another 2 to 3 people, and it's spread through droplets, which means that you have to be either in close contact or it is through, touching objects and then touching yourself. So what needed to be done, and what South Korea did and what India has done also, is firstly diagnosing the cases, because unless you know where the positive cases are, you cannot put in place all the other measures like isolation, contact tracing, and quarantining and follow-up, etc. So the first thing really they did was to massively scale up diagnostics, and I think they were able to do it because they also relied a lot on their private sector. They had companies that were able to scale up this RT-PCR technology, build kiosks and drive-in centers for people to go and test it. So they just started testing, tens of thousands of people so that they could find everyone, every individual. The second thing they did was really go after outbreaks. The same thing that has happened in India also. There was an outbreak there related to a religious congregation. And they had to track thousands and thousands of people who had come into contact with the infected individuals and keep them on follow-up for 14 days. So that also they did very successfully. And I think these were the basic, the two things that were done right from the beginning is diagnostic for everybody who had any symptoms.
But how would you respond to the criticism initially? Well, not really criticism, but well, there were some questions raised on India's testing capabilities, and the opposition tried to rake this that why are we not going for mass testing, etc. Do you think that was really required, and are you satisfied with the way we have ramped up our testing capabilities? We continue to do so. In fact, in the government briefing, we come to know that almost on daily basis we are refurbishing our testing capabilities. More private players joining in. Are we well equipped?
I think so. I think, India has very good capacity in the public sector, and I'm glad the private sector has also been brought in because there's extensive capacity in the private sector. So this is the time to involve everybody who has capacity, all government labs, all private labs. Now, the problem is, of course, that this is not a test that can be just done anywhere. It's an RT-PCR, it's a molecular test. You need certain basic facilities in the laboratory. So that is a constraint for many countries, not just India. And which was why there was a little slow to start, but then now it has been scaled, and I think the plans are to scale it even more. And that's only going to help.
Okay, let me have a quick word from Dr. Mishra. Do you first of all agree with Dr. Swaminathan, and where do we stand today in terms of testing?
Yeah, definitely I fully agree with Madam on this issue. And what I feel, India has adopted a very good strategy. I mean, initially I don't think there was any use of testing each and everyone in the initial stages, and that was very much evident from the samples which were collected by ICMR in the cases which those who have the SARI and other infections, and at that time all the sample initially the 500 samples, they were negative. So I think India, time to time they are changing their strategy based on the data and epidemiological evidences which are coming. As madam has already pointed out, that the role of the epidemiological evidence and the public health is very important in this epidemic. So, as the more evidences they have come, we have strengthened our capacity and we are planning to do more tests, and the time will tell. I mean, if there is more requirement, we will do more tests. If there is no requirement, there is no use investing the resources. So, I think the government of India adopted a very good strategy, and based on the advices of public health experts in the country.
So, do you think that the exponential ramping of our testing capabilities is actually required to kind of gauge the overall impact of the 21-day lockdown? I mean, as of now,
Yes.
Doctor, what are your thoughts on that?
Yes, definitely. The augmentation of this capacity, it was required, and we are increasing it. Right now, the number of tests which we are doing, they are far less than the capacity which we have, and the number of tests which we
that's a
will
good
be
point.
doing. Yes.
Okay,
So,
Dr. Swaminathan, in terms of vaccine now, because do you think there is also a sort of threat or a challenge this relapsing in near future? Vaccine R&D, that all that is been underway. Our doctors are working on war footing. What is the kind of threat or a situation we are looking at? Because this doesn't really confine to lockdown over and life limps back to normalcy. It's not like that. Would you agree?
Absolutely. I think we have to all understand that this virus is here to stay. I think in the early stages, we were still optimistic that it could be contained, perhaps in some geographic areas, 1 or 2 or 3 countries. Like SARS was, SARS was contained in 8 months, and SARS is also another coronavirus, but behaves a little differently. But looks like this virus is really here to stay now. It's spread all over the world, and it's very transmissible. It infects very easily. And so I think we're looking now at living with this virus. It's become another pathogen, just like we have the influenza viruses, we have one more. And so we have to think of long-term strategies. And the long-term strategy is really to have a vaccine that can at least protect those who are at most risk. And I would say healthcare workers is a group that's most at risk, and of course the elderly and those who have other comorbidities. But the vaccine development, normally takes anything from 5 to 10 years. Here, we're trying to accelerate it as much as possible. There is a lot of global momentum, a lot of research going on. But the earliest we can probably have a vaccine for use for the general public is about 12 months. And even then, we may not have the billions of doses needed to vaccinate everybody. So we'll have to collectively think of strategies of how do we protect those who are most at risk by vaccination. For younger individuals, actually, this infection is just like a normal upper respiratory infection, like a cold and cough. It's not really that dangerous. The mortality rate is very, very low in the less than 40 age group. So for them, they could develop immunity even through natural infection. So it will probably be a mix of both, but it's really quite challenging for a government, a country, or a public health agency to assess the risks and benefits of how strict the measures you put in place versus the needs of people to go to work and carry on with their economic activities. And so I think every country now is going to be having to find that balance of having a strong public health system in place where you're confident that you can take care of the patients who get sick, which is again a small proportion of all of those who get the infection are going to get sick and are going to need the hospital, while we work together to develop a vaccine. And I think India will play a major role in vaccine R&D.
Can you share, if it's possible, ma'am, a bit about on the lines, the R&D on the lines, what is being done as far as the vaccine is concerned?
Sure. So the WHO brought together a large number of scientists and researchers from all over the world, and also the private sector, in February to start thinking about a vaccine. So we started this work very early into this pandemic. And what has happened now is that we keep track of what's going on, and we know that there are more than 100 candidate vaccines in development, some of them in academic labs, some of them in small biotech companies, some of them in the large vaccine manufacturing companies. Probably only 2 or 3 or 4 of these would be successful if we are lucky. We still don't know if we will have a vaccine, but we hope for that. There are different platforms being tried, from DNA vaccines and RNA vaccines, which are very new technologies, which have not really been used widely, to the known platforms like viral vectors or inactivated virus or attenuated virus. So we will have a number of different candidates available within the next 3 to 6 months. We'll put together a panel of scientists, global panel, that will look at these and decide about some criteria that should be used to prioritize their further development. It's going to need huge investment in manufacturing, and this is where I think India comes in, because we have vaccine manufacturers who supply vaccines, to half the world's population already, all kinds of childhood vaccines. And so those units could be scaled, manufacturing capacity could be built, so that we're able to manufacture the billions of doses. Like I said, we'll need billions and not millions of doses for this COVID vaccine. So that, and then there'll be policy and regulatory things to look at, so that the regulators would need to move very quickly in order to, license a new product, and there are certain complexities associated with that. But the main thing, of course, we will focus on is safety and the benefits of a vaccine to be used in different populations.
Okay, Dr. Would you want to on the vaccine front?
Yeah, as Madam has already explained very well about the vaccine. The earlier the estimate for vaccine to come is around 12 months, as she has already quoted, and many countries they are working on the vaccine. So until the vaccine comes, it's the only I would say social vaccine, which is the social distancing, frequent hand washing, and all these measures which we can take. I mean, the other vaccine would take some time, but the social vaccine is already available in the form of the measures which we are taking, and till then we have to rely on this social vaccine by to prevent the disease. And as he said, that this virus is not going anywhere, because this has so widespread virus. So what we want at this stage is that the progression should remain the slow, and the younger people, they have some kind of infection, the herd immunity will take over, and then the vaccine comes, and then we can give the doses those who require, especially the elderly people, especially the people who have the diabetes, the cancer, or the diseases which decreases the immunity. So that way probably would be the best strategy to control the disease in coming future.
So, Dr. Swaminathan, taking a cue from what Dr. Mishra said, so we have to have some sort of sustainable strategies post-lockdown whenever it happens, ma'am, because in terms of social distancing, isolating, hand wash, etc. So, do you think this has to be now part of our lifestyles in a certain way? I mean,
yes.
Are we looking at that situation?
We are, absolutely. And this is true for people all over the world. In the Western world, for them, not shaking hands is a big behavioral change. And in Europe, people are used to greeting each other by hugging and kissing each other on the cheek. So even here, people are really having to control themselves and make that behavior change. Of course, in India, we don't have that, because we are used to doing namaste. But then we live in crowded environments. We live in unhygienic environments as well. So I think there will have to be changes made in the office setting, in the informal setting.
Okay.
I'm particularly worried about our slums and the fact that people there need water and soap to really be able to wash their hands. I mean, we keep saying hand washing is the most important, but we need to think about people who may not have those facilities, who may not be able to isolate themselves in a separate room. If those facilities don't exist. So these are the kind of details we'll have to think about. And then we can use mobile phone, I think, I know that this Arogya Setu app has been launched by the government, and because of the huge penetrance of mobile phones in India, I think it's a very good tool to use, because otherwise you're going to need millions and millions of people going door to door. So if you could use the mobile phone and an app on it to track people with fever, to communicate with them, to tell them where to go for testing, to be able to also track all the contacts to find out where they are, whether they are sick. In the US, I heard about a company that was able to track temperatures across the whole country, because they use digital thermometers, and they were able to aggregate all the temperature recordings in the cloud. And
Dr.
they could actually see.
Yes. Ma'am, I'm sorry I'm interrupting you here. We need to wrap it up. But before we do so, very quickly, your thoughts, quick 5 points. Are we much ahead of the curve? A, B, world is looking at India under the leadership of Prime Minister Narendra Modi, and we're being applauded for the way we have contained the situation. What do you think has worked for us as a nation?
I think what's worked is that we have a strong history of public health, strong public health, and I think it's been demonstrated, and the Director General of WHO, Dr. Tedros, actually said in one of his speeches that the world was so surprised that India first eliminated smallpox and then eliminated polio. Nobody ever thought that India would eliminate polio and that we would be one of the last countries, but we were way ahead of many others. And this demonstrated that where there's a will, we have the way of doing it. We have the infrastructure, the administrative machinery to go right down to the village level and do whatever it takes. So I think that's been clearly demonstrated in the past, and we're showing that again now. That's really our strength. The challenge is going to be able to sustain that.
Yes.
While still allowing economic activity to resume, agricultural production to resume, because people do have to earn. So that's going to be the challenge to achieve the balance, but I'm sure that it will be possible. So we also have very good research institutes. Just the last point I want to make is that we also have strong record of investing in scientific institutions, the CSIR system, the ICMR system, the Department of Biotechnology, all the investments that have been made, in biotech in the last few years are actually now going to pay off.
Yes, ma'am. So basically, the economic and human cost of lockdown has to be minimized as much as possible. Many thanks for joining us. I'm sorry, that's all that we have for the time that we have for this edition of Special Broadcast COVID-19. It seems that we all, as a nation, are working on war footing, Dr. Swaminathan. It's a long-drawn war, but I think we are winning this battle every day. Thank you, both of you, Dr. Mishra and Dr. Soumya Swaminathan, Chief Scientist, WHO, for joining us. And with that, from me and my entire team of COVID-19 Special Broadcast, thanks for tuning in to Doordarshan. Namaskar.
Every home has a story, and in every story, there's a home. It is about you, your relationships, your family. This is the home of your stories. Give your relationships an opportunity to grow and make them beautiful. For you and your near and dear ones, LIC Housing Finance makes a humble request. Stay home. Stay safe.
ये विशाल है ना, इसका सब प्रॉपर चलता है।
कल उसके बैंक अकाउंट में 15,000 रुपए का फ्रॉड हुआ है, पता है?
इसको तो कोई टेंशन ही नहीं होती है, देखना।
टेंशन क्यों? मेरी कोई गलती नहीं थी। फिर भी फ्रॉड होने पर मैंने तुरंत बैंक को इन्फॉर्म कर दिया। आरबीआई कहता है अगर आपके अकाउंट से किसी ने धोखे से पैसे निकाले हैं तो बैंक को जल्द से जल्द इन्फॉर्म कीजिए। 3 दिन के अंदर इन्फॉर्म किया तो कोई नुकसान नहीं होगा। जितना लेट करोगे उतना ज्यादा नुकसान। और सुन, सब चलता नहीं है, प्रॉपर चलाना पड़ता है। आरबीआई कहता है जानकार बनिए, सतर्क रहिए।
Dedicated to them, their extraordinary courage, their selfless service, which actually is the very backbone of war against this pandemic. Destination of the COVID care reporting bunch of samples. अभी हम लेबोरेटरी के अंदर आ गए हैं।
उनको सपोर्ट मेंटली और साइकोलॉजिकल सपोर्ट इतना इम्पोर्टेंट हो जाता है कि हम कई बार हम भूल जाते हैं कि हम भी कुछ मतलब है। आई एम ह्यूमन बीइंग लाइक।
Indian scientists have discovered a new species of legless amphibians in the northeastern jungles of India. An amphibian is a living organism that can live both on land and in water. The discovery was made jointly by an Indo-European research team comprising scientists from Delhi University, London's Natural History Museum and Vrije University, Brussels. About 350 species of amphibians are found in India, and among them, caecilians resembling earthworm, lizard-like, salamanders and frogs are the most common. Belonging to the family of caecilians, the new organism is named Cichlidae in Garo language. These organisms are found in damp land of northeastern India. Caecilians are closely related to another species of amphibians found in Africa, which shows that the species evolved much before Indian subcontinent separated from the African landmass. Researchers say that this organism faces danger from local population who kill it, often mistaking it for a venomous snake. Whereas Cichlidae is neither venomous nor does it pose any danger to humans. Dr. Biju has said in his research that northeastern India's forest life has a rich ecosystem, but it still requires more research.
We bring to you a panel of doctors who will bust all the myths and doubts on COVID-19. In this hour-long program, you can ask questions from our panelists.
We have to make sure that all of us stay at home. It is very important that we make contact with other people as minimum as possible.
Follow this hand hygiene practice each time you go and wash your hands, and soap and water is the best.
You have traveled to outside for 14 days to the affected countries, or you have been in contact with a patient of COVID-19 proven case, then only you may require test, otherwise you don't have to.
Founded in 1855, Dharamshala, which literally means the holy refuge, is one of the 80 hill resorts developed in the 17th century by the British. Also known as Mini Lhasa due to the heavy presence of exiled Tibetans living here, it is a perfect getaway for the jaded city souls. The Tibetan influence makes Dharamshala a unique cultural cocktail. This scenic destination is the seat of His Holiness Dalai Lama and has become the center for Buddhist learning.
We like to see everything we can, you know? So that's the reason why. Maybe some want to know more about Buddhism. Well, it's a pity we can't meet the Dalai Lama. We'd like to meet him. I know it's impossible. Well, he was in France a few weeks ago.
But it's a good place to study. It's a good place to get acquainted with many aspects of Tibetan culture. I mean, this is the main draw, I think, for most Westerners who come to this area. There are many, many, many reasons to go different places in India for Indian culture, but probably the Westerners who come here are first attracted to the Tibetan culture.
At McLeodganj, the main suburb of Dharamshala, one can sample the Tibetan.
Every home has a story, and in every story, there's a home. It is about you, your relationships, your family. This is the home of your stories. Give your relationships an opportunity to grow and make them beautiful. For you and your near and dear ones, LIC Housing Finance makes a humble request. Stay home. Stay safe.
Come on boys, let's go practice.
अरे रुक यार, मेरे बैंक अकाउंट में गलत एंट्री का प्रॉब्लम हो गया है।
अरे तो बैंक को कंप्लेन करना।
बैंक को लिखे 1 महीना हो गया है, बट वो गूगली पे गूगली डाले जा रहा है।
तो आरबीआई के बैंकिंग लोकपाल को इन्फॉर्म करो।
रुक मैं समझाता हूँ। जैसे क्रिकेट में थर्ड अंपायर, वैसे ही आरबीआई का बैंकिंग ओम्बड्समैन। आरबीआई कहता है अगर बैंक आपकी कंप्लेंट को 1 महीने में नहीं सुलझाता तो आरबीआई के बैंकिंग ओम्बड्समैन में कंप्लेंट करो। यह आरबीआई का आसान तरीका है आपकी कंप्लेंट सुलझाने का, और वो भी फ्री।
समझे?
आरबीआई कहता है जानकार बनिए, सतर्क रहिए।
Hyderabad, popularly known as the city of Nawabs, located in southeastern part of India, is famous for its rich cultural legacy. A prominent attraction of this modern yet historically and culturally rich city is the traditional Hyderabadi bangle. They are not just symbols of matrimony and accessories for women, but are objects of beauty in themselves. Ask any Hyderabadi and they will definitely say so.
हमने ऐसी चूड़ियाँ कहीं भी नहीं देखी। ऐसी चूड़ियाँ हमें यहाँ देखने को मिलती है और इसकी प्राइस भी एकदम रिजनेबल है। बहुत ही बढ़िया चीज़ है यहाँ पे।
बहुत अच्छी लगी, सब डिज़ाइन अच्छी है। इतनी अच्छी डिज़ाइन हमने कहीं नहीं देखी।
This traditional accessory, generations old, is deeply entwined in Hyderabadi culture, and it has evolved over the centuries from simple glass bangles to modern ones with richly ornamented designs. From molding out the shape by heating and reheating the lacquer that forms the base of these bangles to the intricate embroidery, each step requires elaborate craftsmanship. They are made of various colorful stones or beads that the craftsmen fit in with utmost care and dedication. Making each piece can take anywhere between 10 minutes to 3 hours or more depending on the intricacy of design. Beautifully embellished bangles with colorful beads or pearls exist in abundance and are simply fascinating.
हमारे पास जो माल तैयार होता है, फैंसी माल तैयार होता है। ये लोकल माल नहीं होता है। ये जैसा दुबई फेस्टिवल्स है वहाँ पर भी जाता है, लंदन, जापान, जर्मन, ये वहाँ पर भी जाता। ये नेशनल बेसिस पे ही नहीं, इंटरनेशनल बेसिस पे माल जा रहा है अभी।